Which of the following factors is most likely contributing to her endometrial hyperplasia? A 48-year-old woman with irregular menstrual cycles presents with heavy, prolonged vaginal bleeding. She has a history of PCOS and has been unsuccessfully trying to lose weight. A biopsy of the endometrium is performed and results indicate endometrial hyperplasia. Which of the following factors is most likely contributing to her endometrial hyperplasia? Okay. So the answer that I thought about was not on here, but I still think I know it. Watch me miss it. I would say it's called unopposed estrogen. So anything that increases estrogen, and so her having PCOS is what I'm thinking is the inciting factor. But I think in PCOS you also have a decrease of progesterone, and so that's kind of what like leads to unopposed estrogenism is kind of what I would describe it as. So decreased estrogen is not the answer because it's the opposite. Hyperprolactinemia, I don't think has anything to do with endometrium proliferation. Increased testosterone production, same thing. I mean, that does contribute to virilization, but not to this. Ovarian cysts, I don't think so. I would say decreased progesterone production.
Okay, good. Yeah. So remember, it's the imbalance, right? Like you said, right? It's the endometrial lining is a balance between two hormones, and those two hormones are going to be estrogen and progesterone, right?
Mhm.
Estrogen promoting endometrial proliferation, progesterone inhibiting it. So of course, if you have irregular menses with PCOS, because there's more LH than FSH, meaning there's more estrogen than progesterone. If that's the case, then you're going to keep building that layer, building that layer, building that layer, meaning
Yeah.
endometrial hyperplasia, right? And so, yeah, I like that you kind of pointed out that the answer that you're looking for is increased estrogen production, which you don't see here, right? Meaning that you don't freak out and you kind of think of the mechanism overall and pick something that supports kind of your, mechanism, right? Don't kind of go off the chart and be like, well, maybe it's hyperprolactinemia, right? Don't kind of try to search for something that's not there. It's usually just in a different form.
Yeah.